Hello and welcome to another episode of Family Office Stories with me, Lisa Cornwell. Today I'm joined by Kevin Buechler. Did I say it right, Kevin?
Yes.
Yes, I've been practicing. Who is the CEO of SIP Medical Family Office. Kevin, thank you for joining us.
Welcome. Thank you for having me.
So let's start. What is SIP Medical Family Office? We all hear family office in lots of different ways. Medical family office is quite a unique word, I think.
Yes, that's right. So we're basically a family office for your health.
Yeah.
Right. So similar to a traditional family office looking after your family structure, your corporate structure or governance, we basically do that for your health. So we manage your health and we create like a governance structure and a strategy for your health planning.
Okay, so are you doctors or it's more around the methodology? Like, can you share what you do kind of in practice?
Yes, so we're not doctors.
Yeah.
We're basically case managers or health advocates, as we call it. And we developed a methodology based on primarily 4 pillars, which we apply, which we see as crucial for anyone's health planning and health strategy.
Yeah.
And I can tell you just what those 4 pillars are. And I usually start with what we call the medical records management. It's the most boring one. It sounds boring as well, but it's super critical.
Go on.
Basically what it means is we housekeep and we organize centrally all your medical data, your medical records.
Yeah.
Because we usually see only looking at an individual, in 95% of the cases, those documents are spread across the world with clinics and doctors and hospitals.
Yeah, of course, yeah.
But never where they supposed to belong, which is with yourself as the patient or as the client. And there is times when you need very quick access to that to avoid overtreatment, to avoid delay of treatment. And we make sure that this is all centralized together, not just for one individual, but usually across the family.
Yeah. Okay. So that's pillar 1. What's the next one?
So the next pillar is then prevention, and that bases on the medical records management. Because once we have an understanding of your personal medical history and your family medical history, we can see a risk profile and we have sort of like an anamnesis. So we understand what is the risk profile. We understand what are your health priorities. And based on that, we can bring you to the right preventive screenings, longevity programs and similar. And that's all based on basically your family history, your medical data, but also basically on all your data.
Yeah. That's super interesting. And are most of your clients then, are they older? Are they, what age range are you dealing with?
It varies a lot. So the youngest member that we look after is, I believe, 2 years old.
Oh, wow. Okay.
Yeah. The oldest member is probably in their 80s.
Okay.
And so depending on what stage in life they are, they're usually at different pillars where they have their focus.
Yeah. Okay.
Because obviously you want to invest into prevention to avoid any disease to happen as far as you can. But the reality for most of us is at some point in our lifetime, we'll face a diagnosis, we'll face a medical condition that needs treatment. And that is the 3rd pillar, which we called privileged healthcare.
Right. Okay.
And that's basically navigating people through the healthcare system, making sure that they get to the best specialists and doctors internationally and to get to them fast. So you not have to wait for 4 weeks or 6 weeks to get an appointment, but you get it within 2 or 3 days maximum.
Yeah, that's super interesting.
And making sure that people follow the right processes to make sure that, they have their second opinion, their third opinion, that those opinions are possibly from different countries, because different countries have different medical schools, different best practices.
Yeah.
So if you want to invest and make sure that you get the absolute best decision for yourself, you might want to consider solutions and approaches internationally. You want to educate yourself to then make an educated decision on what is the right approach for your treatment.
Yeah, or even, I guess, get reassurance that the path you're choosing is the same wherever you are.
Absolutely right. Yeah.
So then what's the 4th pillar?
The 4th pillar is international private medical insurance. And this is basically where we come from. So SIP was founded in 1997, so close to 30 years ago, as actually a broker for international private medical insurance.
Ah, okay.
And this is basically the health insurance class for globally mobile, wealthy, affluent individuals and families, because it's a type of policy that you can continue seamlessly independent on where you're relocating, and you can keep it for lifetime, which is never the case with any domestic private medical insurance.
Yeah, it comes up a lot with our clients, actually.
Yeah. And usually only when there's problems.
Yeah, exactly. The definition of insurance, hey? So this is super interesting, but how did you get into it in the first place?
Yeah, so actually for me, what is driving me on this purpose to protect people's health is a personal experience that I've made. So in my late teenage years, I've had an ear infection, which was treated very wrongly or not correctly. And the result of that, I'm living with a tinnitus, with a ringing in my ears for the rest of my life.
Oh, wow. That's not pleasant at all.
Yes. And at the time, I was not really realizing that, but, more and more. And even today, I'll realize more like the magnitude of what that impact actually is, because it's impacting your quality of life for the rest of your lifetime, basically. And it could have been avoided so easily by just standing up for yourself, having the know-how that not everything in the healthcare system goes the way that it is supposed to go, and that you have to look after yourself. And going to visit another specialist could have resolved that entirely. So this is the idea of what we're doing and the mission of SIP. It's protecting people's health and trying to avoid that something like this happens to anyone else. And of course, my personal experience, that's a very minor experience, right? So I still have a very good quality of life, but there is every day a lot of people that come across medical incidents that are much more severe,
of course,
that are impacting them very, very significantly, and not always, but often there is things that can be avoided.
Yeah, no, I totally agree, and I'm sorry to hear that. But if I then think about the kind of the trends that we see happening, so people living longer, presumably this is becoming increasingly relevant, and you're seeing more and more people thinking about this as a topic.
Oh yes, it's absolutely incredible. Like this longevity trend, or hype, I should probably say, over the last, I'd say 3 to 5 years has been, increasing year by year significantly. And actually, as a result of that, and because we observed that quite in detail, we've decided at some point to run our conference around that.
Yeah.
And that's more to then make people realize what is actually the reality, what is scientifically proven, what is evidence based. Because in this hype of longevity, there is a lot of marketing around. There is a lot of money to be made. So there is a lot of treatments and things that are proposed which are actually not science based. And what we want to avoid, again coming back to protecting your health, is to avoid that individuals become the guinea pig of an industry, for example.
Yeah.
But there is other things that are quite on the rise. For example, Alzheimer's, dementia is one of the biggest concerns with many of our clients, because arguably the generation that's holding the wealth at the moment is one of the first one to actually go through a longer period of time of dementia and Alzheimer's, where actually modern medicine is keeping one alive for so long that actually the brain health is not keeping up with this age progression, and you get into this situation of dementia. And next generation is the one to experience what does that actually mean for a family when there is someone within the family that suffers from dementia or Alzheimer's. And this is one of the things that people are incredibly afraid of. And so today we know that actually there is around 80% of your Alzheimer's risk is epigenetic and only 20% is genetic, which means that, you do have an influence on it.
Wow, I thought it would be the other way around.
No, actually not.
Not being a doctor.
So there is actually, today, there is only a handful of clinics that are as sophisticated in this brain health area that can provide you a personalized Alzheimer prevention strategy, which you can then follow over, 10, 20, 30 years, which should avoid that you'll get into this situation at some point, or to, a high degree, you can avoid or prevent things from happening.
That's really interesting. Because we were saying before, we're starting to see this more and more from the kind of tax legal framework that we work in, where you have people who no longer have capacity, but the family don't want to kind of confront it. And so you, particularly in the with structures, there's somebody who has decision-making powers and they're not able to make them anymore, but nobody's doing anything about it and you get stuck. So I can see there's a huge real-world application here.
Yeah. And it's, I mean, it's incredibly complicated if you just think about the family dynamics, which is one part of it. And then there is, the health side of it. And it's the individual patient side of it. And when we look at, and it's probably also another reason why there is so much more focus on health, because if you look across a lifetime of a person, what are the happenings that are really shaking their lives? In most cases, or in many cases, it's significant diagnosis. It's whether you are diagnosed with a cancer, it changes your life from one day to another. If you suffer from, mental health issues, you can have all the wealth in this world. If you don't feel secure, if you don't feel happy, it's not going to help you. So that's why we see quite a lot of people now getting to this realization and wanting to invest more into their health, and also looking for advisors that are, able to help them navigate this healthcare system.
Yeah, and take a completely kind of agnostic view at what's going on and cut through the noise. Because like you say, there is so much. I mean, I won't show you my algorithms on social media, but I'm personally quite interested in this topic and I get spammed with stuff all the time. So what would be your key takeaway that you'd want listeners to think about SIP Medical Family Office?
Yeah, so I think, key takeaway is that, realization that there is type of medical family office, which is very new. I think we're probably the ones that have pioneered this concept. I think there will be many more to follow. But people to know that there is, a type of sort of approach or advisor that can give them guidance. So this is obviously a good key takeaway. But then what I always say to people is the most important takeaway for anyone is that basically you have to take ownership of your own health, because it's not happening by itself. Also, when you're entering the healthcare system, when you have a diagnosis, like many people would just go to visit the next doctor and rely on their advice. But reality is you need to look after yourself, because the system is not looking after you. The system is benefiting from primarily returning sick patients. So you have to take that ownership. You have to realize that the healthcare system is by no means perfect, right? There is mistakes that are happening. What it is that's with everyone in the office world or in the medical world. Problem is just that if it's in the medical world, the significance of such a mistake can be much more severe. And if you can, if you have the wealth, that's probably what you absolutely want to avoid.
Yeah. And at the start, before we started recording, I said to you, is it right to say health is wealth? And you said, yeah. Yeah, I'm convinced. And so last thing, we like to kind of finish on a light-hearted note. So for anyone listening, what's your number one tip for health if you were advising me 20 years ago?
I'll tell you, it's very, very simple. So with everything that you see, the algorithm on your social media and whatever therapies and treatments and what is recommended, like the most important factor for your longevity and for your quality of life is just, movement. So you need to get up, you need to move. If you have a body that keeps functioning, that is agile, that is, able to do some sports, etc., like this is, this can heal a lot. This can prevent a lot. So the most important, if you're listening right now, maybe you get up and listen to the next episode on a walk. Yeah,
it's very good advice, and actually something relatively easy for us all to do. So on that note, I'll say thank you, Kevin, for joining us. That was really interesting, and speak to you soon.
I appreciate it. Thank you.
Thanks, and bye, everyone.